I'm not aware of anything that we have suggested was dangerous or false that's turned out to be correct.
Touching on the issue of funding though, last week in estimates we learnt, or through a Freedom of Information application, that the Department of Home Affairs were using their platform to seek to censor, I suppose, or make recommendations to social media companies to censor COVID-related posts. They say they did so at the behest of the Department of Health. Can you tell me whose decision that was, when that began, and how much the funding was for that project?
So there was no funding for the project. That was a matter that was about taking advantage. The government made a decision to take advantage of a capability that the Department of Home Affairs already had in place to be able to look broadly across social media that they had in place for various security reasons. We certainly worked closely with them from the Department of Health in terms of the evidence base against which things should be assessed, but there was no sort of funding agreement between us.
They say their funding runs out on the 30th of June. That's funding from a different source? That
would be a matter for the Department of Home Affairs.
Okay. And whose decision was that to commence that project, to utilise that system with the Department of Home Affairs?
I actually can't recall exactly where the decision came from, but we could check. Sorry, it was during the peak of pandemic.
Just sort of happened.
I think, Senator, we were concerned about clear misinformation being promoted in social media and other channels. Information that on the balance of scientific evidence was clearly incorrect and frankly dangerous.
Yes.
So I don't think we don't apologise for wishing to. Certainly, there's a fine line, as I'm sure you're aware, between people, a community member expressing an opinion and someone expressing under the guise of scientific knowledge completely erroneous material. So we don't apologise for wishing to not have, frankly, incorrect and dangerous material.
Would you apologise for things that were taken down that turned out to be correct in hindsight?
Well, I'm not aware of anything that we have suggested was dangerous or false that's turned out to be correct.
I think there were a few. There were some relating to transmission, as we've seen today.
I think, Senator, we've had this discussion on many occasions. The vaccines early on, in the earlier strains, were clearly effective in preventing transmission. As strains evolved, they became much less effective in preventing transmission. The effect in preventing transmission is quite small now, but early on in the Alpha strain, the Delta strain, the effect on transmission was probably one of the biggest factors in controlling the Delta outbreak in New South Wales in late 2021. They did work on transmission early on. They still work very poorly on transmission. We'd have to agree with that. The effect in transmission is very short-lived, and it's not the reason we're vaccinating people now. We're vaccinating people now to stop severe disease. But to say that they did not impact on transmission is a lie. They did impact on transmission, and the effect is much less than it was.
The vast majority of that time, though, we were dealing with Omicron, for which it was not effective in terms of transmission. So
not as effective, no, not as effective, and it certainly didn't stop transmission. But even now, the vaccines have a short-lived effect in transmission, which is very short-lived, and we acknowledge that. And so the strategy around vaccination is not to stop transmission. It is to stop people dying, and it's got a 93% efficacy in preventing death from COVID. These vaccines are very effective.
And still safe, you say?
And still safe,
well,
yes.
You're still clinging to the fact that they're safe?
Every vaccine, we've discussed this on many occasions, every vaccine has some adverse effects, and we know that a very small number of people tragically had severe complications with the AstraZeneca vaccine, not nearly as many people would advocate, but absolutely but every vaccine has complications. Vaccines have always had adverse effects, but the cost-benefit, the risk-benefit ratio of the COVID vaccines is very much in the favour of their benefit to the community.
That's an entirely different subject, and I entirely disagree with you, and I think that's entirely wrong.